wanted to thank everyone today for coming to the COVID vaccine call. This pandemic has definitely changed all of our lives, and there's hope on the horizon, at least in some of our eyes right now. We sent a recent survey out to our staff, and we wanted to get their input on the vaccination, and we have a lot of questions, and I think a lot of people do. So the effort of the call today is to give true education from reputable sources so that people can make educated decisions on whether or not they choose to receive the vaccine. So today we have a few of our doctors with us. We have Dr. Ryan Sears, who graduated from Oklahoma College of Osteopathic Medicine in 2010 with a focus in family medicine, and also I think main focus now is geriatric medicine. Is that correct?
Absolutely. Yep. Geriatric medicine, do a little palliative care also in the hospital setting. So I've been kind of seeing that side of things as well.
Sure. And Dr. Sears and myself, even though he's been part of Kansas City Medicine Partners for a while, he and I met in March when the whole pandemic started, and he's actually worked very closely with us on our infection control and to help us through this pandemic. And also with Kansas City Medicine Partners is Dr. Kristi Shaumeyer. She graduated from University of Kansas School of Medicine in 2003. Oh, hey, Traci. In 2003, focused in geriatric and internal medicine. Dr. Sears is our regional medical director, and Dr. Shaumeyer is our medical director. We also have Dr. Reginald on here as well. He graduated with honors from University of Kansas School of Medicine in 2010, physical medicine and rehabilitation. He is our physiatrist. Is there anything else you'd like to add, Dr. Fears?
Honors, but I graduated from the University of Kansas School of Medicine.
Very good. And spent some time down in Wichita, I know that. But I very much, Dr. Shaumeyer, I met really when we first partnered with Kansas City Medicine Partners, and she's been great as a medical director for our facility. And just recently, in the past probably year and a half, I met Dr. Fears as we brought a physiatrist group on rehabilitation. And when he and I spoke, I mean, he's right in line with everything we wanted to accomplish here in senior living for people in rehabilitation and really in the community. So then you see some other faces and some blank screens on the call, and those are some staff members that we have that have questions today. I think the first question, Dr. Fears, if you don't mind, what is COVID-19 and who is it affecting?
So COVID-19, COVID belongs to a family of viruses called coronaviruses. Coronaviruses are viruses that cause illness such as your common cold, severe acute respiratory syndrome, and Middle Eastern respiratory syndrome, which SARS and MERS, which we've all probably heard of. COVID-19 actually is a virus that's closely related to the one that causes the SARS virus. And for this reason, scientists call it the SARS-CoV-2 virus. And you'll see that often in the testing that we get when we send out for tests for people. So that is what COVID-19 is, who it's affecting. COVID-19 is affecting, to date, actually, worldwide, there are over 68 million cases of COVID worldwide. There are over 15 million of those cases here in the U.S., over 290,000 deaths here in the U.S., and over 1.5 million deaths worldwide due to COVID-19. Who is COVID affecting? 40% of those who died thus far live in long-term care facilities. So our population has been impacted tremendously by this virus. Other people who are affected by this virus are mostly people in lower socioeconomic statuses in this country, and have no other options than to live in closer proximity to other individuals. So if you have multiple families living in a home that may not have other options, if one family member gets the virus, then there's likelihood that that virus is going to spread pretty rapidly amongst the other individuals in that household. So yeah, those who are living in multiple families, living in a single household and in cramped spaces are going to also be groups that are going to be highly impacted by this virus.
Yeah.
Sorry about that. I said both those categories hit very close to home. We take care of the population that's most at risk, and many of our employees may be in a situation that it is a housing situation in which we live close to each other, you know. So we definitely see it from both sides. So point of this call is to talk about the vaccine. It is very close to being out here in the United States. It's already been released in other countries. So we want to get some questions answered. Dr. Shaumeyer, could you provide some details about the vaccines, maybe about the 2 potential vaccines that may be coming to our doorstep here in the next 2 weeks?
Yeah, absolutely. So first of all, when COVID became known, there are actually in development a couple hundred vaccines, different companies working on them. And in the United States, in order for a vaccine to get approved, it has to go through preclinical trials. That's where they would test the vaccine in an animal model. Then it has to go through phase 1, 2, and 3 trials. So there are 2 vaccines now that have reached the phase 3 trial, and they are in the process of getting an emergency approval. And the first one is the Pfizer vaccine, which is being reviewed tomorrow. And that vaccine trial enrolled over 40,000 people. And then the second one is Moderna, which will be reviewed next week. And that vaccine trial enrolled over 30,000 people. If they get approved, we could have the vaccine from Pfizer available by the 21st. We could have the vaccine from Moderna available by the 28th.
Thank you for that. So you mentioned about quick approval and whether you or Dr. Fears want to handle this question. I'm going to jump to that one. You know, we've heard a lot on the news, and what we've heard from the news is this is the fastest a vaccine has ever been approved or has ever made it through these trials. And it almost gives the feeling that, and they almost use the words rushed. You know, that's what I've heard, but I've heard additional information from reputable sources lately. Can you all describe how we've gotten to where we are really as quickly as we have?
So I'll take part of it, and I'll let Dr. Shaumeyer maybe handle another part of it. So I actually think this is a great thing. I think this is kind of a marvel in where we are in terms of our ingenuity with creating vaccines. I don't think it's rushed. Let me be clear about that. I don't think it's rushed. I just think that because of the worldwide impact of this particular virus, I think that many nations have had to put together their brain power and scientific ingenuity to develop a vaccine as quickly as possible. And I actually think that that's something to be proud of, that as a world, you know, we have the know-how and ingenuity to be able to create something that's affecting humankind this quickly. So I don't think that it's rushed. As Dr. Shaumeyer pointed out in her answer, this vaccine hasn't jumped any hoops that other vaccines aren't required to do. It's had to go through the phase 1, 2, 3 clinical trials before it's been able to be moved to market. I think the other thing that I find comfort in is that not only that, you have independent review bodies that are reviewing the safety and efficacy of the vaccine. So it's not the pharmaceutical companies themselves that are not only in charge of the doing the trials, but also telling us the safety and efficacy. We have independent bodies that do that. And the World Health Organization has a global advisory committee on vaccine safety that's also been very instrumental in making sure that these vaccines are safe before they move to market to be given to people. So I feel very comfortable that we've gone through the right stages to get this vaccine for us.
Both of these vaccines are a type of vaccine called an mRNA vaccine. And it turns out that Dr. Fears had mentioned the MERS and the SARS, that these scientists that came up with the current vaccine have been working for decades trying to come up with a vaccine to SARS and MERS. So they've actually, in reality, kind of been working on this vaccine without knowing it for the last 20 or 30 years.
That's really good information. And correct me if I'm wrong, Well, those things put me at ease as compared to, like I said, how it's been portrayed on the news so far. And something that I heard in a recent conference, actually yesterday, was that, as you mentioned, no steps were skipped, but steps may have been combined. Smaller steps may have been combined, and that's what helped with the timing as well. And I think, like what Dr. Fears said, I would assume the reason for that is because of how important this vaccine is. But again, nothing was skipped. Everything has gone through trials that every vaccine has gone through. Thank you for that. So we have partnered with CVS, and the timing of the vaccination rounds are as follows. If Pfizer gets the okay tomorrow from the FDA, then we will see the earliest the vaccine coming to our community on the 21st. Moderna, again, on the 17th, they get reviewed, and then we'd see them on the 28th if that's the vaccination or the vaccine that we're able to have. So here's what will happen. We get one or the other right now, okay? So they come in, CVS is going to give us a call, and they're going to say, these are your 3 dates, all right? This is when we're going to be there. We're going to be there in December, and we're going to be there in January, and we're going to be there in February. In December, you get on the train or you don't. And once it leaves the station, that train is not coming back around again until February. Here's what that means. If you get the vaccination in December, you will have your follow-up second shot in January. If you did not get the vaccination in December, as of now, you will not be getting a shot in January. You will have to wait until the end of February to get your first round, and then you get your second round in March. That's the information that we have now. That's why it's so important, and we're taking this time to try to educate as many people as we can, because, like I said, train leaves the station, there's no putting on the brakes, okay? So once we pass that December date and CVS is gone, we will have to wait till the end of February before you could get vaccinated again. So Dr. Sears, some questions about vaccination. Jaliyah, you have a question. Would you like to go ahead and ask Dr. Sears your question? You'd have to take yourself off mute, miss. Oh.
Yeah. I basically was like, well, you already answered my question, Cassidy. Basically, if we take it in December, then we got to take the follow-up one in January, you said?
That's correct.
Okay. And then I was like, how will it affect my baby, like if I'm going to breastfeed? So let's say I took the vaccine in December, I'm doing January, like will it affect like me breastfeeding or anything of that sort?
Yeah, I'm really glad you asked that question, actually. So there are a few populations that we have not had the end results of studies for. One is in pediatric populations, and we're really talking less than 16 for the majority of these studies. We don't really have a lot of studies completed yet specifically for that population. They are ongoing. I know Children's Mercy specifically has a study ongoing using vaccinations that are available or becoming available to really say the effectiveness for children, and also, you know, really that phase 3 trial that gives us a little bit more information about the safety. Now, when it comes to pregnancy in particular, again, we still have some ongoing trials that will tell us more about pregnancy. The initial emergency authorization is not for populations specifically that are pregnant. So we're not at this time advising that for pregnancy right yet. The other population that they did comment on was for breastfeeding or lactating mothers. We do not have or not seeking approval for that specific population yet. So at this time, we're not advising those that are currently pregnant or plan to breastfeed in the near future or currently are breastfeeding to receive the vaccine. That's not to say that we really have concerns specifically related to the safety in that population. We just want to make doubly sure, as we, Dr. Shaumeyer and Dr. Fears have pointed out, that every single step is being followed as it should be to study specific populations to ensure that the effectiveness is there, which is one of the biggest factors, And then also on the second part of that, to ensure the safety is there. And I wanted to add to that, that we had talked about earlier with regards to the speed and the safety. That's why we're doing these things in the way that we're doing them. It's also about the amount of people that we're putting in, right? Dr. Shaumeyer had pointed out the 40,000, 50,000, now 60,000 in the Pfizer vaccine trials and 40,000 in the Moderna trials. The reason that these are so safe and that we know so much information about them is not because of the length of time. It's about the amount of people that we really get into these trials. Because most adverse effects from vaccines are within a short time frame. And in fact, it's within a 2-month time frame. And that's why the FDA had to have that 2 months of time at least to complete and say, okay, we've got this phase 3 trial. You've got 60 days after that of safety. Now you can really say that these vaccines are safe. I think we get held up a lot on these long-term safety questions. Most vaccinations that we've given in the past have really no long-term consequences. It's the short-term things that we need to be looking out for. And again, that kind of speaks to that in that question too.
Okay. Yeah, that was my biggest question that I had.
The rest questions for here for a little bit are going to be questions that we got through our survey from our employees. Will the vaccine prevent you from getting COVID? And this is to Dr. Sears. Will it prevent you from getting COVID? What's the success rate with the vaccines?
Yeah, so also great questions there. With regards to prevention of getting COVID. So the virus itself and the actual disease it causes, this can become very confusing. So SARS-CoV-2 is the virus, COVID-19 is the disease that it causes. We use them kind of interchangeably a lot, and we usually just use COVID-19. What we're saying there is in both these vaccines, we're looking at 94% and above of preventing the COVID-19 disease, right? So the disease process, meaning that people are not having symptoms in 94% and above. That's great news. And it's even better when you actually look at how many people have to be hospitalized or have severe COVID. In the Moderna trials alone, no single person went into the hospital that received the vaccine, not one. In the Pfizer, I believe out of the entirety, it was 2 people ended up in the hospital. So that's great news, because that really solidifies that it prevents symptoms from developing in these populations. Now, here's the caveat that we very much believe this prevents transmission in some way, but we can't say with certainty how much prevention that does. So for now, what we really need is the maximal amount of people getting this vaccine to really protect these vulnerable populations. And we really need those vulnerable populations to get the vaccine for sure, because it protects them directly. Because we really don't know for sure how much it prevents the transmission of the virus SARS-CoV-2 yet. But again, based on every vaccine we've had in the past, it's very likely that this does a good job, a very good job, maybe an excellent job at preventing a person from passing it along. And we already know that people that are asymptomatic throughout their entire course of having this virus are less transmitters than the people that have a lot of symptoms. And so when we know that information, it gives us some reassurance that when we're seeing people that don't have symptoms after getting this vaccine, even if they did get the virus itself, they're probably not nearly as transmissible as people who would have had symptoms or would have caught COVID-19.
Yeah, that's a part of it too. How long will it be effective?
Yeah, so right now we're still looking into that. So at this point in time, we believe that it's going to be longer effectiveness than what we're seeing from the natural infection of COVID-19 itself, meaning that if somebody gets COVID-19, we think that their protection is less lived, like maybe 3 months for some people, maybe a lot longer for others, maybe 6 months. But for the vaccination itself, we believe that it's likely longer, just because having had the vaccine, we're seeing a lot more immunity and a lot more response when they're actually drawing things like the antibody levels, the T cells, which is another thing that a lot of people are forgetting, that T cells are another big part of the response to this virus. And those are actually studied in these vaccine trials. And we can say that those levels are very high when we compare it to somebody who naturally got. So we assume very much so that this vaccine will give us a longer amount of immunity than a natural infection would.
Thank you. So when I get my first shot of the vaccine, when does it start to become effective? Do I have to wait till the second shot?
So that's another great question. So you do need to wait for the second shot, but what I want to emphasize is there's not going to be necessarily you get these 2 shots and a time frame in which we're all safe to go back to normalcy yet. We're not quite at that point yet, and we're hopeful to get to that point in this next year, and earlier the better, obviously, if more people get vaccinated, which is why we're so hopeful that so many people will accept the vaccine. The 2-shot series is common for most of the vaccines that are coming out. So as Dr. Shaumeyer pointed out before, there's over 100 in development, and we're approaching 200 in development right now. Never been done before in history, and that many vaccines being developed at the same time, which is great. And as Dr. Fears pointed out, we're putting so many resources in. What we're seeing from the vaccines that are currently coming out is that they're a 2-shot series. Why 2-shot series? Well, just as in childhood, when we receive our booster shots in vaccination, that's what it's supposed to do. It's boosting the immune response to the actual virus itself, which is probably a lot of why we're getting better results with the vaccine than we would be getting from natural immunity. We simply just can't give somebody the natural infection, then give them the infection again and boost up their immunity. So the vaccine is going to give you that second shot to boost that immunity up. So what's the time frame on that? Well, Pfizer's 21 days in between, and they'll always save a booster shot on both these vaccines or the AstraZeneca after it for each individual person. So if you get one vaccine, you've got a shot saved for you. You've got one reserved for you. So they're going to come back around and expect you to get that second one, unless there's, for some reason we just can't, for some reason. So what we're saying there is they're going to save that booster shot for you at 21 days. Then after that 21 days, at a 7-day time frame past that, we get 95% protection. Okay, so that's where the studied time frame was, and so that's what we're going with. Moderna, a little bit different, 28 days, 2 weeks after that, and then we get to that 94% protection. And the AstraZeneca is a little bit different than that one too, but the time frames are roughly similar on those two.
And we'll dig a little bit deeper into some of your statements here in a little bit. Were aborted fetuses used to create these vaccines?
So with regards to that, I do want to comment on that specifically. There are cell lines that we use in research throughout multiple different things that we do, including the monoclonal antibodies, the Regeneron thing that obviously we heard about with the president receiving that. There are cell lines we use for safety testing, which are specifically, in this case, we're talking about kidney cell lines, which are considered cells that replicate indefinitely. And I think a lot of people have concern about those things because we've heard about the cases of Henrietta Lacks and these types of cases in which we've taken cell lines and we have them continuing, and then we continue to study them. This is a different example here. So in the 1970s, there was a donated fetal sample that was used, and the cells from that sample and no other cells beyond that time have been taken to test for safety. They're not producing the vaccine with the cells. They're not producing any individual vial, any component of the vaccine with the cells. They're using it to test the safety of the vaccine and the effectiveness of the vaccine. Now, Moderna used that for their safety trials. The Pfizer vaccine had not used those cell lines for their safety trials. Some of the other vaccines that are out there use different cell lines. So these things are used throughout medical research widely. And I want to emphasize that even common medications that many people take use these types of cell lines for study. And it is not an uncommon practice that we use these. but we're not in any way using fetal cells that are in any way new fetal cells from any kind of abortion to produce vaccine that is going to go into a person. That is not happening.
Thank you. Do you know information about how the vaccinations will be transported?
Yeah, it's a great, information too. And I did want to kind of go back to my previous comment too, is that, with regards to information, I do emphasize to people to check reputable sources with regards to vaccine information. There is going to be a ton of information coming out from all different sources. You really want to dig into when you see a source, when you see a headline, look at where the background information came from. There's going to be a lot of people that are so-called experts putting out information that really don't know what they're talking about. And there are reputable sources such as the World Health Organization that Dr. Fears pointed out, the Centers for Disease Control. I know there's, just in this political climate, there is a political, cloud of mistrust that's going around right now. We don't want to be in the medical community and in the vaccine community involved in any kind of politics. Okay, we don't care if someone's Democrat, Republican, we just want to save lives. Okay, we're not going to give you a vaccine knowing full well that it would cause anyone to have harm. We believe very strongly that the benefits of these vaccines outweigh the risks, and I encourage you strongly to look into any kind of information that you see or somebody says, and really just look through that information yourself, ask other people, get some more information about it. So as far as transport, now I'll get off of that subject. Transport.
It is important to be said, because what I've found from right now in our surveys, we have a good group of people who are very ready to get the vaccine. We have a very small percentage that don't want it, and there are some people who are COVID recovered that meet that criteria. But the biggest chunk is people in the middle that have questions. And it's those types of questions. It's that mistrust that is keeping people from feeling confident about the correct information that they hear. So thank you.
Yeah. So touching back on the actual question, transportation, right? So the Pfizer vaccine, probably everybody's heard by now, it is a challenge for transportation. I worry more about vaccines not potentially getting to their source area or to the area that we're going to distribute in the way that we want them to, but I'm worried less about the vaccine being effective when somebody receives it. Is CVS, Walgreens, they are going through strenuous testing of their systems to make sure that every single person that gets a vaccine is going to be an effective vaccine that's been transported in an effective way, that has kept it cold enough. They have temperature regulation, they have monitoring systems. I'm more worried about some vaccines, unfortunately, not making it because they've been so thorough in their checking that they have to dispose of vaccines because of the temperature regulation. Having said that, again, these transportation systems are not just Walgreens, CVS. It's actually FedEx, UPS. These systems have been set up prior, actually, for transportation of many other products. So we've got infrastructure in place. It just needed to be tweaked a little bit to allow for transport. So they're going to transport them also for the Pfizer vaccine in specially designed transportation medias. So we're talking about containers that have been designed to stay ultra cold with dry ice and to contain a large amount of vaccine. They can be distributed within that 24 hours period of time. So they've got a little bit of time once they get it to a site here. But the bigger one is that we're going to have multiple vaccines, right? We're going to have this one, that is temperature sensitive. We're going to have the Moderna vaccine, which is less so on the temperature sensitivity, which is great because it can be kept in a freezer, a standard freezer, for a month's period of time, and can last longer in a refrigerator for longer. And then the other vaccines, such as AstraZeneca's, Johnson & Johnson, will be able to be kept like vaccines normally are, such as the flu vaccine, where they can be kept in a fridge simply. So as we get more vaccines, we'll be able to keep more vaccines around. I do want to emphasize, just as Cassidy had said, it's really important, though, if you're thinking, I think I want this, to sign up early and get that vaccine, because it may be a while before you get that chance coming back around. We just simply don't have enough vaccinations yet to give everyone a vaccine. And so if the opportunity comes about, yeah, seriously want to consider it.
For sure. And I'll speak a little bit more to that as we go forward too. Thank you, Dr. Sears. I'm going to transition some questions to Dr. Fears now, if that's all right. And a question for you, Dr. Fears, is what if I've already had COVID? Do I still need to get the vaccine?
Okay, I might lean on my colleagues for this, but after you've gotten after you've tested positive for COVID, your body will develop some antibodies. So if you are reinfected, you're probably going to experience a severe infection. But this vaccination you should still get the vaccination just for better immune protection from a reinfection with COVID-19. So I'll say that in short. I'll let my other two colleagues chime in if they want to go dig deeper into answering that question.
Yeah, the current recommendation is to still get the vaccine even if you've had COVID, because we are seeing people get reinfected.
Yeah, and I know talking to you all, you have patients that are now starting to become reinfected. My wife's physician assistant, the people she takes care of, it's been 8 months or less, and some of them are getting it again. Mm-hmm. And some people, not to contradict what you said, Dr. Fears, but some people are getting it worse the second time. But people are getting it a second time. And the thing about this virus, and we'll talk about herd immunity in a little bit, but the thing about this virus is that it is so freaking infectious, and it hurts the people that we take care of at a higher rate. So it's just, we need to be equipped the best that we can, especially going into this season with all the spiking infection rates. So a question, Dr. Fears, and I'm going to have Jessica go ahead and ask this, and it's about some side effects from the vaccine. Jessica, are you available?
What are the potential long-term and short-term side effects of the vaccine?
All right. I think my colleague here is going to help me out. Dr. Shaumeyer, you want to?
So Dr. Sears was saying earlier, we really are looking at effects in the first couple of months and not really long-term. But I know for the Pfizer vaccine, the biggest side effect was just injection site irritation, and that was in about 80% of people. But I think we've all had the flu shot. We have the same thing where you get kind of some pain at that area. That's the most common. That's the most common side effect. People also complained of fatigue afterwards or some body aches, but no serious side effects.
Yeah, right. I wanted to touch on that too. I think many of you will hear today some new information with regards to the United Kingdom, National Health Service receiving the vaccination. And I want to just, kind of get some information about that that's actually accurate, because you're going to see a lot of titles coming out that's saying, if you've had allergic reactions, do not receive the Pfizer vaccine. That is not the intention of the announcement from the United Kingdom and the National Health Service. What they're saying there is for people who have had severe anaphylactic reactions to many different products, they may have a severe anaphylactic reaction to the vaccine. And what we're talking about is out of thousands already that have received the vaccine, we're talking about 2 people who already had an EpiPen on them because they have that bad of reactions. So these people are very aware that they have had reactions in the past. React to any product that is out there in the world, any kind of injection, any kind of medication, any kind of food. So there's lots of different potential, allergic reactions out there. But what we're really talking about here is for people who have had severe anaphylactic reactions to medications and to foods, then they obviously want to let their provider know. That is the first announcement that's come out with regards to this. This was not widely seen in the studies themselves, but does not mean that that is not something that we will see occasionally. It happens with every vaccination that's out there. So this is not unique to, COVID-19 vaccines. It's not unique to any vaccine. We've seen anaphylactic reactions to all drugs, all vaccines, all matters of foods. So when people see these announcements, I want everybody to take that with a little caveat that that happens normally.
And just to add some additional clarification to it, anaphylactic shock is what you're saying as a reaction. So many people say, well, I'm allergic to this, I'm severely allergic to this or whatever, because I think my tongue might itch a little bit. Anaphylactic shock means that your body goes into shock, your airway closes, and you will die. That if you have not had that reaction in the past, what you're saying is that it would be a very rare occurrence for this to happen to you now. The people who have the allergies know they have the allergies and have to carry the EpiPens. Like one of our employees, she was talking to me about the vaccination because when she was born and they started to do their first rounds of vaccinations on her, she went into anaphylactic shock. And if she wasn't at the doctor's office, she most likely would have passed as a baby. You know, then they found, I think it was the DTaP or whatever was before the DTaP, there was something in it that could potentially do that. And she had a reaction to it, you know, so she would be one to be a little bit more wary for this vaccination. But I've never had a reaction. I've never had that type of reaction to anything in my life. So I'm not going to be concerned about that when I get my vaccination.
Yeah, it's a great point, Cassidy. I mean, what we're really talking about, and the announcement that they put out was severe allergic reaction, meaning anaphylactic shock, a closure of the airway, drop in blood pressure. These are severe reactions that are very rare in occurrence. This is not, I had an adverse reaction to a drug in the past, such as I developed diarrhea, or as you said, itchy tongue, or something along the lines that was not a severe reaction. That is not what we're talking about here. And I did want to get ahead of that today because, you know, as you see these headlines come out, as we talked about, you know, various news sources will grab that and will take bits and pieces of that information and highlight that information. The National Health Service did not intend that from their announcement. What they intended to say is that we need to be monitoring these people that have had these severe reactions closely. Again, most people that even have anaphylactic reactions are able to make it to a hospital setting and or urgent care setting, receive epinephrine, and even for some simple reactions, things like Benadryl, and that's the end of that reaction. So it's a very easily treatable reaction as well. And both these individuals that had this reaction are just fine, and they were fine within minutes of receiving their treatment that they already knew that they may need.
Something that CVS came out with as well, and this was one of the questions to the staff, is that there will be, I don't know the detail of the monitoring yet, but I believe it's for the 15 to 30 minutes after receiving the vaccination, there is monitoring of staff that's going to be required and residents. So to put that out there. To the doctors, does the vaccine affect different age groups differently?
I can speak to that. I mean, if you're talking about side effects or adverse effects, you know, which is mostly what we're talking about is adverse effects here. In the age groups above 51, which they break up their ages a little differently than we normally do. We don't say geriatric, you know, in their studies. In the age groups above 51, we actually saw less adverse reactions. And that probably speaks to the immunity and the immune response, how it changes over our lifetime. We may react in less, you know, in different ways to certain products than we do, you know, early on in our lifetime. But we're actually seeing less adverse reactions, which again is great news that we're seeing less of that, and also that we're seeing less people having to be in the hospital for it.
Thank you. Will the vaccine cause infertility?
No.
You know what does cause infertility? Mumps, right? Doesn't mumps cause infertility?
It can,
Rubella.
yes.
Right. So sometimes not getting the vaccine can lead to infertility. Thank you for clarifying that. And that's please, we are not making light of anyone's questions. If we smile or anything like that, there is no stupid question. These are really good questions to ask. Infertility is important. My wife and I have it. You know, it's a big deal. I totally understand. So we respect everyone's questions. Thank you for being able to ask them. So Dr. Shaumeyer, some more questions about side effects. So if I have other health conditions like kidney problems, chest pain, heart murmurs, skin conditions, will the vaccine potentially affect this?
It will not. And you also have on here a question about it affecting skin conditions.
Right.
It won't have any effect on that either, except for the fact that you're getting an injection. So it's not the vaccine itself, but the fact that you're introducing a needle to the skin. So sometimes that is irritating, but I would imagine they wouldn't do it if you happened to have a rash in that area.
Yep, gotcha. Thank you for that. And a couple more questions for you. We talked about this a little bit already. Will the vaccine make me sick? Or even at a higher level, will it cause cancer?
It will not cause cancer. It may make you feel sick because it's causing an immune response, but it doesn't actually make you sick. So, and the two vaccines that we're talking about, they are basically just a piece of, it's RNA, but that's similar to DNA. It's basically a piece of DNA. That's all that it is. So it's not an actual virus. So it can't actually give you the virus.
Thank you. That's a really important part too, and a question that people have asked. You know, is it a live virus? No, it's not. It's just a piece of RNA. Viruses use RNA. We use DNA. Correct.
Yep.
And so to piggyback on the cancer question, Traci, is there a question you'd like to ask the doctors?
I am a cancer survivor. How could the vaccine affect me?
So because you're a cancer survivor, it is very important that you get the vaccine. I know we've talked about the type of cancer you had, and you're at very high risk of becoming very ill if you do get COVID. So the vaccine itself is not going to affect you. I've looked it up, and it is recommended that you can still take it with immune suppressants because it is not a live vaccine. So people that are on steroids, people that are on medication for Crohn's or rheumatoid arthritis, they can still get the vaccine. But those are the very people that are at the highest risk. So those are the ones that we really, really want to get that vaccine.
And I'd love to back that up. Oh, sorry, I didn't mean to interrupt you. I'd love to back up what Dr. Shaumeyer is saying specifically there. You know, there's a few different things with regards to cancer. I know there's been rumors with regards to change in genetics with the RNA vaccine. That does not occur. Those things do not happen, just like the virus itself doesn't do that. And the biggest thing I tell people about adverse effects from vaccines is if the virus doesn't cause it, the vaccine doesn't cause it generally, except for the reaction thing that we talked about earlier with anaphylaxis, because we're actually injecting it. That's the reason that it does that. But if the virus itself doesn't cause the thing, the vaccine doesn't cause the thing, because the reaction our body is having to the vaccine is the same thing at a much lighter level than it would have to the virus itself.
Okay.
Thank you.
Good. Thank you.
Traci, thanks for that. Appreciate it. Now we have a question from Charnelle for Dr. Shaumeyer. Charnelle, you want to go ahead and ask your question?
Okay, my question is, does the vaccine have certain risk adverse effects for different ethnicities? Brought on what the reality of America is today, regardless of how anybody feels or the population and how people was raised, because you touched on the environment and education and things like that. Since that population of certain ethnicities wasn't tested, how would that affect, or what reassurance can you give us with that being said?
So your concerns are completely valid, because there is a history in this country of underrepresenting our brown and black populations, particularly when it comes to healthcare. So in these two vaccines that are coming out, about a third of the test subjects were minorities. And in fact, the Moderna vaccine was actually on schedule to be ready before the Pfizer vaccine, but they didn't enroll enough minorities. So the FDA made them go back and enroll more minorities so that we could be assured that it is safe in all populations.
Okay, well, so with that being said, that you just telling me that information, should I go towards the Pfizer vaccine or should I lean towards more the Moderna vaccine?
I don't think we're going to have a choice.
Okay.
I think we're probably going to end up with the Pfizer vaccine because of the freezing requirements that the state is probably going to send those vaccines more towards the big cities where they have the deep freezers, and they're probably going to send the Moderna more towards the rural areas. That's my guess.
Yeah. I think your point is great though too. You know, which one would you choose based on that information? That's why the FDA made them go back. So they had to include more groups in there, and so even doing that, the safety was the same. So they went back and did the same thing that Pfizer had to get the populations to ensure safety in all groups. And so regardless, they showed that the safety was there. The differences were, there was no statistical differences between any substantial group. So whether we're talking about Black, brown population, Native American populations, women versus men, there weren't statistical differences between the groups that actually were there, which could give you reassurance that both the vaccines are actually just as safe. And the fact that the FDA protected everybody by saying, hey, you need to go back and do this is a good reassuring thing too, hopefully.
95 and 94.5.
Okay.
Yeah.
I think
So,
just to reemphasize, I'm sitting here next to Dr. Shaumeyer, and just to piggyback on what both of these doctors have said, the efficacy rate was very, very high in both of those vaccines, which I think to get an over 94% efficacy rate in a vaccine is absolutely amazing. I think at the beginning of this, when this virus first started, they were looking at maybe 60 to 70% as being a potential target, but to get 94 means that these vaccines are very, very effective. And I can't emphasize that enough. If you get either of them, I think you're going to do fine.
I'd like to so something that I heard on the news that in talking with my wife, she educates me a lot from the medical side of things, and something that we heard on the news very early on and haven't really heard it recently was that minorities were more at risk of adverse effects than others of getting COVID, and they made it sound as if you are Black, if you are Hispanic, if you are whatever minority might be, you're going to get COVID worse. And my wife explained to me the truth behind that, which the news did not. Would anyone like to chime in on that statement? I know that that's really deep. I know that's really deep and may have to go to another time as well. But if you'd like to, this is a very real concern of our employees, very much so.
So I guess I'll chime in a bit. I think you have to, many of the things are disparities, and those healthcare disparities are things that are impacted by education, by access to other social determinants of health, pertaining to housing, pertaining to employment, and all of that milieu of things can affect someone's ability to access healthcare. And so when you hear those numbers, I think you have to take a step back and understand all of the other social determinants and other public health determinants that bring those statistics to bear as to why Black and brown communities have suffered disproportionately from the virus. I don't think you can take those numbers in isolation and say, oh, a Black or brown person, you have to understand the things behind that.
It's more societal than genetic. Correct.
Correct.
It's probably a combination of all the above. But I will say that my minority patients that have gotten it have fared fine. So, but they're in, like Dr. Fears was saying, they're in a nursing facility. They had access to testing. They had access to a doctor. They've all done fine. So to some degree, it is going to be the fact that many of our essential workers are minorities. the fact that they may be living, like Dr. Fears said, multi-generationally, multiple people in the house. So they're just at higher risk of exposure. So it's all of that. It's all of it.
Yeah, and I think a great statement came out the other day, and this was, Dr. Fauci who said it, and he was, in front of a group that actually was putting him to task, and we should be. I think there's a lot of concern from the past history of the medical field and how people have been treated in the United States prior. And so there's a lot of that concern out there, and it's justifiably out there. But what had been said by Dr. Fauci, which I absolutely agree with, is don't deny yourself a great thing because of the concerns of the terrible things that have been done in the past. This has been shown to be a great thing. There are many groups that are going to benefit substantially from receiving this. Let's not let any group get left out because of fear right now, because this has been shown to be effective, as we've tried to reassure, and Dr. Shaumeyer pointed out that the effectiveness, the side effects are the same across all groups. And we don't want anyone to miss out because they have, reasonable concerns about the past itself.
In that, the opportunity that we have, I'm going to talk to here in a second about that, because we've pointed it out multiple times, and I hope people are hearing it. We have an opportunity like we have never had. I'll speak a little bit in a second. But some questions that I'm going to field are, what will the vaccine cost me? Dr. Williams with Department of Health and Human Services from Missouri said that the vaccine will cost people in Missouri $0, nothing, absolutely nothing. The next question is, will it be required? This is a tough one. Right now, as of today, it's not required at McCrite Plaza. There will be other places that require it, just like many hospitals require their staff to get a flu shot. That's why we're taking the time to educate you. That's why we're doing and investing the effort that we are, so that you please make a very well-educated decision. And I guess my real ask, and I'll ask again at the end, is to get vaccinated. If I don't take it, no, you will not. What will happen if I miss work because of side effects? Okay, it's a little complicated because of the transition of our presidency here at the end of the year. So currently, if you have some side effects that are semi-related to COVID, potentially if you have not used up your federal leave time, and we ask you to stay off, then potentially that may be covered. I can't say 100% right now. I cannot. And then and that would only be until December 31st. The second round is in January. We don't know what the government's going to come out with yet. Okay. That's the truth. I can't answer your question right now, and I'm sorry for that. But as the doctors have said, the likeliness of a side effect is small. And if you do have the side effect, it's pretty minor. Okay. Are religious beliefs acceptable reasons to refuse the vaccine? As of now, you don't have to get the vaccine. So it could just be because you're not going to be told what to do. You don't have to have any specific reason. And that's as of today, December the 9th. Okay. Things may change depending on how bad the community infection rate gets. But as of now, you're not required to get it. So got a couple more questions and we'll wrap up, and thank you all for your time. So to the doctors, so we've heard of herd immunity, and one of my friends said, you know what, we just need to get rid of our masks. We all need to get this and have it be over with, because we'll get to herd immunity. So how long would it actually take, if you can answer that, to get to herd immunity? Or is there no way of getting there unless we use the vaccine?
I can't give you a timeline, but what I can tell you is that to get to herd immunity, you have to have between 70 to 90% of the population having been infected. The U.S. population is about 328 million people. So we've had about 15 million cases. So we would need to get to about 229 million cases. So more than 10 times what we've had already. We've had 290,000 people die. So we'd need to get up to about 6.8 million deaths in order to get to herd immunity. So to me, that's not acceptable.
Well, and that's on the timeline in which the infection rate has been now. So
Correct.
you could also think about the fact that we are on a surge of a surge. We're
Right.
even seeing it in our own testing here at work, that people are coming back from Thanksgiving positive. I don't want to get too far into it. But and again, the point is of getting the vaccination and putting a halt on the virus the best that we can for healthcare workers is healthcare is going to be overran to the point where not just because if you have COVID and you go to the hospital, will they have a bed for you? It's if you get in a wreck and you break your neck and you need to go there, or you puncture your kidney or your spleen, will there be a bed for you there? You know what I mean? So this 100% will, our decisions will affect everyone. It's a very important decision. So thank you. So really, without getting a vaccination, there is no realistic way to get to herd immunity without, in my mind, and I don't want to put words in anyone's mouth, but in my mind, it would be a total chaos and
Yeah.
a world that none of us want to live in. I mean, we can't take the world that we've lived in for 8 months. Well, I'm tired of it. I know everyone else is, you know, but that is nothing compared to, thanks, Traci. That is nothing compared to what the world will be like as infection rates continue to climb and people get sick. And also because you can get it twice or you can get it 3 times because the wheel will keep freaking turning. All right, I'll stop. Okay, so I asked this to all the doctors. What's the biggest pro of getting the vaccine, or what is the reason to get vaccinated? And if all of you would chime in, I'd appreciate it.
Well, I can tell you what I always tell my kids when I make them get their flu vaccine every year is, you know, they're living their lives, they're having a good life, and this is the one thing that they know that they're saving somebody's life. So we get the vaccine. It may not save our lives because we're fairly young and healthy, but you don't know whose life you're going to save, but you know that you're saving somebody's life by getting that vaccine.
That's probably that kind of took mine right there for sure, because that's what I was going to say is like, I feel like it's a civic duty at some point, you know, not to say that, you know, you shouldn't worry about yourself or your family members or all those things, but you absolutely should. If for some reason you have an immune compromised person that won't actually develop immunity because of getting the vaccine, some people will have a hard time actually, you know, even though they got the vaccine, they may not be able to fight back like other people will. You're protecting them. You're doing the job for them, right? You're helping them out. You're giving that, you know, kiddo that doesn't have an immune system that can't fight these things off another shot by doing that. So literally go out there, do your civic duty, you know, get the vaccination, protect your patients, protect your coworkers, protect everyone around you, do the right thing.
I guess I see it as our pathway back to normalcy. As Dr. Shaumeyer laid out with those statistics and a lot of the thoughts flying around and, you know, things like herd immunity, that would be a disaster. So in short, I think that the vaccination is our pathway back to normalcy. That's what we have in our toolkit right now, in addition to staying vigilant about mask wearing, staying vigilant about hand washing, staying vigilant about, you know, wearing PPE. And I know that it's worn on all of us, but we are very, very close. And I think that these next few weeks are going to be crucial to whether this turns out to be something that's less than if we just rush back to doing things the way we want without acknowledging that this virus is still ravaging our country.
So at what point, how often in your life will we have the ability to truly make history? History from here, the history of COVID-19, of the disease, will be written about. This is a very large pandemic that has affected the entire world. Mm-hmm. What point in how often will we ever get the opportunity to truly write how history will be written? We have the opportunity now. Will it be prolonged? Will people look back on our generation and think, What were they thinking? This is the point in time, as you have said. This is the time to make a change and to make a difference, and to be able to save someone's life. So I just want to for those that are watching, I just want you to stop and think about last year at this time. Last year at this time is way different than this year, right? Way different. So much has impacted our lives. And this look of Christmas has totally changed. So as we go forward, many of us have had loved ones or have known people who have COVID. Maybe we've had COVID. We've known people now who have started to die of COVID. I promise you, if this continues on, we will have one of our loved ones die from COVID. If it continues on, it will happen. It will happen. You will have a loved one die. It will potentially get to there. I love my friend's kids. She's compromised immune system. I don't think she already barely makes it through life. This will kill her 100%. So we all want normalcy, as Dr. Fears said. And the only way to get back to it, I truly feel, is through vaccination. If I didn't feel this way, I promise you I wouldn't be saying these words. And we are actually super, super lucky. Initially, the round 1A, which is the round that we're in now, initially round 1A was only going to be for the healthcare workers in hospitals, and we were not going to be part of it. But people advocated for us as healthcare providers in taking care of the highest risk population. And because of that, they have said now we as employees, whether you're an employee in skilled nursing, assisted living, intermediate care facility, or residential care facility, or have some type of contact, as an employee, you can get the vaccine. The only residents that will get a vaccine during the first round are skilled nursing. So if you love your assisted living residents that you take care of, you have the opportunity to get the vaccine before they do. You can personally say that I've taken the step to keep them safe. So, and like we've talked about all through this, so as we go to make our decision on vaccinations, we have to make sure that we have reputable sources. That's why I asked Dr. Sears, Dr. Shaumeyer, Dr. Fierce to be on this call, because I trust them. I trust what they tell me. If they, people ask me at the very beginning, will you get the vaccine if it comes out? I said, you know what, I'll talk to the doctors. And if they feel it's fine, then I trust them. We can't listen to what people are telling us, just what they think they hear. We can't get crap off Facebook. We don't have to worry about getting microchips so that they can track us, because guess what? If they want to track you, they already are through your freaking phone. So stop. Those things are not realistic. It's not going to turn you into a lizard person either. We have to remember the source. So, and when you listen to the news, realize that every news station or every news affiliate or whatever it is that's pushing that out has a reason and an end game in mind as to how they portray what has gotten out there. And that's why they use those headlines, because they need you to watch. So be certain. If you have questions, I know these doctors would be happy to answer them. They take the time because they care, and they care about the people that we take care of. I mean, they've been on this call. This is hundreds of dollars that they could have been made doing something else, and they're not, because they care about you as well. So again, it's our time to write the history books, all right? It's up to us. It won't happen very often, but this will be in the history books, 100%, I guarantee it. So please educate yourselves, because I hope I hope that you're standing with me on that first day when CVS is here, because I give you my word, I will be in line for the vaccine. So to our staff members and to the doctors today who took their time, I can't thank you enough. I don't know if you have any last comments, but I think I'll stop.
Just happy this vaccine's finally here. Let's get back to normal, everybody.
Dear God, please. Thank you again.
Cassie.
Yes, ma'am.
I do plan on taking the vaccine.
Well, thank you. I want you to be around too.
Yeah.
Worry about all of you. I worry about all of our employees and
All
all of
right.
our residents. And if you don't believe that, then you don't know me yet. And I'll get to know you once I can see you again after vaccination. So thank you all again. See ya.
Look forward to seeing you again.
Yes, ma'am.
Bye.